right, so this is the day that I am supposed to call Victor Boudreau's office yet again for a scheduled meeting time. His EA assured me that we would be hooked up with the date today. I'm gonna talk with him directly about his comments that doctors don't need to service trans patients if they disagree morally and religiously with their identities. I want to know why he felt comfortable saying that and what sort of message he wishes to send. Let's see about that.
Please stay on the line while your call is completed. Department of Health, bonjour.
I was speaking with somebody from your office last week, and they assured me that they were meeting with the health minister this morning to talk about potential meeting times for people who are on the wait list to meet with him.
What's your name?
AJ Ripley.
I can talk to the secretary and get back to you, and if I can put you on hold?
Yeah, sure.
Okay, just one moment.
Thanks.
There's no answer, and I tried to get another one, and there's no answer either. They might be on lunch, so I don't know what's going on with that.
I wanna be in the quiet zone, wanna be here on my own, wanna see what I can do, but I don't know what I'd be if you were to go.
My name is AJ. I chose that name. How cool is that? And I chose that name because it was gender ambiguous. I chose a symbolic amalgamation of my birth name because I don't want to forget the last 29 years of my life before I came out as trans. I'm not mad at those years or memories. I'm a little disappointed at myself for not figuring out my situation sooner. I could have saved myself years of depression and anxiety if only I knew the name for what I was feeling. And now I do, trans. I'm at a very interesting point in my transition where I look like a lot of stereotypes. A butch lesbian, a gay man, Justin Bieber mostly. But the confusion doesn't bother me because I feel beautiful for the first time when I look in the mirror. I understand and I appreciate the face that looks back. Since I already told my coming out story in March when I came out very publicly on After Ellen, I'm going to try to approach tonight's storytelling in a fresh way. Who I am. It's really hard to describe yourself without using gendered language, but I'll try. I'm a person, I'm a family member, I'm a sibling, I'm a friend. I'm a nerd who's getting a PhD, I'm a writer and a performance artist. I've lived in 5 great provinces in our country. My favorite feeling is biking along the path without using the handlebars. I want to teach young people the power of words and how they can make life better for everyone through art and writing. And the truth is, you might never get to know any of these other things about me if you stop listening after you hear the word transgender. So if you have a story about difference, keep telling it, even when it's hard, and it will usually be hard. Thank you. So in 2006, when Pride got started, we first had the parade. They asked us to walk along the walking trail out of view from the major city center. I think that they symbolically wanted us to be able to have a pride parade, but they just didn't want it to interrupt what is really a white, middle-class, heteronormative environment in Fredericton. Today we're on the main city center streets. We're on King and Queen. We're walking up Regent. We've got our signs. Everyone's excited. It's going to be a great day. And when Pride first got started too, political parties weren't a part of it. They didn't come, and you'll see today there's a lot of liberals, NDPs, they're wearing shirts. It's sort of becoming what it looks like in Halifax, which is mostly a marketing adventure. Emma, do you want to carry this? Who wants to? You will? Perfect, thank you. What's your name?
Astrid.
Astrid? AJ, nice to meet you. All right, so I see some human beings on the sides of the street. That's pretty cool. It wasn't always the case back in the day. I wish they were smiling a little bit more. Shall we chant?
Now, what do we want?
Trans healthcare!
When do we want it?
Now!
What do we want?
Trans healthcare!
When do we want it?
Now!
What do we want? When do we want it?
Now!
What do we want?
Trans healthcare!
When do we want it?
Now!
What do we want? Trans healthcare!
When do we want it?
Now!
High five. Hashtag trans problems. My voice, because of testosterone, has completely given out.
New Brunswick is the last province in Canada that does not fund gender-confirming surgeries. And as you may or may not know, this is a big issue for the trans population because our suicide rates are so high.
So the Premier was supposed to get up and address the crowd. The organizer of Fredericton Pride told him that if he was going to do that, then Mr. Glant also had to address the trans healthcare access issue. He chose not to speak, so unfortunately we weren't able to demonstrate or do any protesting, and the issue again just goes silenced. So even though he's not speaking, he's still here. So I'm going to try and chat with him if you want to chat with him. Yeah? Okay. Hello.
How are you?
Good. Where's the Premier?
He had to take off.
Ah, that's
Yeah.
inconvenient.
Yeah.
He just didn't address anyone or want to do any of that? Or?
I have no idea.
Okay, yeah, because I thought he was supposed to give an address to everybody, sort of, but he didn't. No.
I'd love to have a chat with you sometime.
Yeah.
That would be much better than trying to get into it on Twitter for me. Like sit down, tell me, what the issue is.
So have you heard about the petition?
I've heard of the petition, yeah.
Yeah? I mean, it's great that you're here visibly, but I would just love to actually see what you guys can do for us on the ground politically.
I'll be around here this week as well for the trans issues panel. I'll make sure I'm there. And,
Awesome. We'll be speaking. So.
Being female is hard. Doesn't matter if you're trans. Equality is not there as much as anybody wants to pretend that it's there. And the second thing I want to say is that every trans person is a person.
So what are your preferred pronouns and how you'd like to be introduced?
My name is Hayden, and I go by she, her, hers pronouns. I've been trans-identified for around 4 years, but I only started medically transitioning around 7 months ago. And what that looked like for me was this new clinic opened up, Clinic 554. You've definitely heard of it. And that was basically the only reason I was strong enough to come out and say, okay, I'm ready to start medically transitioning. And it was something that was really difficult for me because I have a rather conservative family, and it's been very volatile and dangerous and scary. So being able to go to a doctor's office where the doctor just said, here's what is going on. You're trans. I understand that you're trans. Do you want to start working on this? And instead of, oh, you're really messed up, you better start dealing with that yourself. This is what's going on and this is how we treat it. And in that office, it didn't feel any different than having a common cold. I mean, obviously a little bit more detrimental to your health, to my health, but it was treatable. There are treatment options, and they were laid on the table, and I went forward with it. The whole idea is that I couldn't look at myself in the mirror, I couldn't shower, I couldn't go to bed with pajamas on because it was too revealing for me. I couldn't look at myself, I couldn't touch myself, I couldn't stand to be myself, and I still can't, but it's better, and now I'm finally working towards being able to wake up in the morning, look in the mirror, and just take care of myself.
I live in New Brunswick, which is the only Canadian province to deny financial support for gender reassignment surgeries. All 9 other provinces and 1 territory in Canada provide some level of publicly funded surgeries for transgender people.
I feel really humbled to be here tonight on this panel. As a cisgendered person that works within the healthcare sector, which can sometimes be oppressive and can be limiting to, I'm sure, several of the people that are here today.
When I first started out doing this work, it was really kind of the Wild West, word of mouth. There was a lot of firsts. And now as time has gone on, I think that we've sort of established a network where we know who we can refer people to. So now things are better, but there's definitely areas where services are sort of lacking. And I think that the specialized providers sort of understand and know kind of how to help trans patients, but it's really hard for people to find their way through the system to get to those people sometimes.
And how do you encourage your patients to sort of navigate their way through that system?
Well, it helps that I know people.
Yeah.
So if they can make it to me, a lot of the work I do is trying to put them in connection with people that can help them. The rates of suicide ideation and the rates of suicide like attempts are astronomically high for the transgender population. One study that was done in Ontario said that about 77% of transgender people have at some point in their life contemplated suicide, and 43% have attempted suicide. For me, somebody who works with youth, what's even more alarming is that youth are 2 times more likely to contemplate suicide than adults, and 3 times more likely to attempt suicide. What we know in terms of the research is if people are able to transition, whether that's medically, socially, in terms of their vital statistics and their gender marker and all that stuff, if they're able to transition, then those suicide rates, the depression, the anxiety drops off completely.
So we're here at the Beaverbrook Art Gallery where my best friend, Marie Fox, has her latest exhibit up. This is a piece she did 2 years ago. It's funny because I remember the day just like playing with plastic and having a lot of fun, but just being so kind of upset and sad with my life. And when I look at this now, the only thing I can really recognize is the eyes, and it just brings up a lot of emotions for me because I can see the pain that I had inside of me for so long. And I didn't think I would live past 30 at that point. I was 28 there, and I didn't imagine that I would make it to 30. So as a 30-year-old standing here in a completely different body and looking at those eyes, I kind of just want to hold that person and let them know that it's going to be okay. So I'm sitting here at Clinic 554 in Fredericton, which is the clinic I go to. I'm sitting here with my doctor, Dr. Edgar, who I've been seeing now for, I guess, 20 weeks. So trans health, how much of that would make up what you do, maybe?
We have about 1/10 of our clients are trans.
And is that, would that be disproportionately high?
I think that's huge, yeah.
Yeah, what would, let's just say an average physician, what would their trans patient health rate be?
Well, actually, we don't have enough data on that. Stats Canada collects information on a lot of things, but they don't collect information on trans identities. So we just don't have numbers about how many people we think are living in Canada who are trans. I think the problem comes with underestimating the community, the need of the community, the size of the community. I don't think that physicians or people who are working in government really understand that there's a lot of trans people, and so you need to have more than one specialist who's working in the field.
Yeah, and I mean, just to really zero in on what you just said, that is important. And when you get a politician in the media saying, if you are a family physician and you are morally or religiously opposed to trans identities, then you can pass care along to someone else. Is that a dangerous message to be sending?
Well, there's 2 answers to that question. Is there a danger inherent in delaying access to medical care for trans people? Yes. The Trans Pulse study in Ontario was the largest study of trans health needs in Canada, and they released a paper just this year that demonstrated that the delay equates to death. People have more risk of suicide if they're made to wait. However, you do want people accessing care with people who are compassionate and able to provide a level of quality of care that the patient needs and deserves. So I wouldn't want a patient to feel like they were stuck with a doctor who didn't respect them or didn't feel that they could understand their medical needs. Doctors have a lot of power in society, so much power in society, and I don't know that we particularly need to have our rights be more important than the rights of a patient. We talk about transgender people, but actually we're also referring to a diagnosis, a mental health diagnosis that used to be gender identity disorder and has recently been changed to gender dysphoria. Gender dysphoria has to do with the experience of suffering that interferes with the person's ability to really function day to day. And at the core of that, you're talking about discrimination. You're talking about all the ways that people are excluded from society. And you can't necessarily erase the discrimination people feel, but you can sure help them navigate it in safer ways by appearing, in a way that is more aligned with how they see themselves or how they wish they could look in the mirror and see themselves. And then people get better.
I want to call on those of you who want to be allies to do more. When trans people are out in the media, we are constantly forced to be in situations in public where we might be assaulted because someone recognizes our picture from the paper and knows that we're trans and hates trans people. That's a fear that I live with every day right now.
So we've been both separately and together, you more than me, doing a lot of activism in the community. If we can look ahead to the future, what is the best case scenario for a trans person in New Brunswick?
So best case scenario, we get the healthcare coverage. Another best case scenario is that we'd have human rights protections implemented because New Brunswick doesn't have gender identity or expression in their human rights code right now.
What?
No, we do not have that in our human rights code.
Our human rights code is somehow different than other, national human rights codes?
Canadian provinces all have their own human rights codes, but New Brunswick does not have gender identity or expression in the code, which is actually a huge struggle for the Human Rights Commission. It's basically twice as much work for them if a trans person is fired for being trans or is kicked out of their house for being trans or something like that.
Federally, Canada also has issues around legal protection for trans people. After years of struggle to get Bill C-279 through Parliament, the Senate killed the bill earlier this year. The bill aimed to add gender identity and gender expression to the Canadian Human Rights Act and Criminal Code. The death of this bill leaves transgender Canadians unprotected against discrimination. As a trans person, this terrifies me, considering that I know lots of trans people who have been fired or verbally assaulted. So, Gloria, if you wouldn't mind just telling me a little bit about yourself and how you identify your preferred pronouns, where you're from.
My name's Gloria Dawn. Last name Halverson. I go by she. I suppose that's fairly apparent. I'm involved in the community. I came out last year in August. It was very scary. The culmination of it was the Pride Parade in St. John, New Brunswick. I marched in the parade, pictures were taken, I posted them, so friends, families, clients, here I am. When I attempted to get my gender marker changed after I changed my name, I was informed that I can't unless I've had the surgery.
Did they define what the surgery meant?
They didn't define what the surgery was, but it had to be surgery that changes your gender. It's rather interesting. I was called by Vital Statistics, who actually does this for you, and was asked if I was going to change my marker. And I explained to them, well, because of the surgery rule, I can't. And they told me it doesn't matter exactly what surgery, as long as your doctor feels that it has altered you sexually and is willing to sign it, we will accept it and change your marker. Which means it's less of a rule and more of a personal preference. It more comes down to people to change the M to F. What I'm striving to attain here, similar to other provinces, is that I can change my gender marker or someone else can change their marker without having to have surgery. In my case, I cannot get full surgery. I'm a cancer patient. I've had a radical prostatectomy and lymph nodes removed. It didn't work. I had 9 weeks of radiation every day, and that didn't work. Oddly enough, oncology tried hormone therapy on me. And that worked because the type of cancer I have, testosterone feeds it, it grows off it. My maleness was literally killing me, ironically enough. So transition for me is also about saving my life. It's just ironic that I am a transgender woman in this situation.
So yeah, you couldn't have the surgery yourself?
Yeah, I can't do it, but they require that I have it to attain this. But I am transgender, I have the same issue as someone who can get this surgery. So is that discrimination? It's one of my arguments that I bring forth. I do feel it's discriminatory because I am not physically or medically able to attain a requirement. It doesn't seem fair. It made me decide, well, if the rules aren't right, let's change the rules. And I'll be going forward with a human rights complaint. Social acceptance and acceptance by government is a huge thing, and it's a huge hurdle we have to cross. The other provinces in Canada they've done this. That's why I have so much confidence in this human rights complaint, because the precedent has been set over and over and over. I am accepted by my community as a woman. I've gone to medical professionals to substantiate and validate I am a woman. The province, the government should accept that. How can a minister deny the claims of a medical professional?
It's an excellent
it makes no sense.
We're trying to figure it out. Yeah.
All right, do we have another question?
Hi, my name is William Stever. That's the name my parents gave me. I'm 61 years old. I was diagnosed with gender identity disorder. Let me tell you, young people, get it done now! I have a granddaughter in Ontario that I could not go to her first communion. I have suffered all my life, and there's no help. None.
Hi, I'm Gloria. It's not really a question. I just wanted to speak to the person. I forget your name already. I'm so sorry. I feel your pain, and I've gone through it. My son disowned me, and he kept my granddaughter from me. People, they need time to digest it sometimes, and sometimes it takes longer than others. About a week and a half ago, he relented. I got my granddaughter back, and we had a wonderful day. And you could have that coming too, and I just wanted to say that to you.
I never really know what my blog is gonna be about. This week was about Pride Parade, obviously, and got me thinking about my first Pride. And then just last night, we experienced this pretty amazing thing at the trans panel, where a person who identified as William came up to the microphone and shared their story about coming out at 61. I started thinking about how there must be a large number of people in the community that wait and what that feels like to come out when you're older. Pride is a time for celebration when you identify as gay, bisexual, and lesbian. A time to honor those before you who advocated for law changes and rights. But as a trans individual, Pride is still very much political. When we are being murdered and killing ourselves at catastrophic rates, Pride is a memorial. Pride is a rally for life.
Trans healthcare! We want it now!
I'm traveling to Toronto to learn how transgender patients in Ontario navigate the private and public healthcare systems. I'm meeting with people who have accessed the publicly funded system, while at the same time looking into what is available through private care for my own surgical needs. UFCW Canada, Canada's private sector union, and CPATH, the Canadian Professional Association for Transgender Health, just completed a national scan to confirm what transition-related medical procedures are publicly provided in each province and territory. The scan confirms that 9 provinces in Canada, along with 1 territory, provide some coverage for gender-confirming surgeries, excluding the Northwest Territories, Nunavut, and New Brunswick. However, most people travel to Montreal, Quebec, to access the only Canadian clinic that provides all gender reassignment surgeries to trans patients. If I were to access surgery tomorrow in Ontario, what are the options available for that?
In Ontario, the first step would be that they would need to get a referral to the Centre for Addiction and Mental Health. They are the one place at this stage that can provide approvals for surgery.
What's the wait time like to get into CAMH right now?
Right now, we have been told recently that it's around 900 people.
And with 900 people, I'm just trying to wonder, time-wise, what does that look like? Like how many months or years?
Well, at their current staffing levels, it's more than 2 years.
I'm going to meet Sophia Banks, who is currently on the wait list for her gender reassignment surgery.
I came out as trans about 3 years ago and started hormones and transition and the whole public reveal kind of thing.
Can you speak to your own experience trying to access healthcare here in Ontario?
Yeah, I started going through like a support group, and through there I was seeing a counselor, and I had to get that letter from them saying that I was a trans woman and that I was okay to start hormones and transition.
Was that hard to get, that letter?
Well, as I was going through that, I actually got told that if I wanted to get a letter saying I was a woman, I had to wear more dresses.
What?
And that...
Who told you that?
A counselor at the Sherbourne Health Centre.
They told you that you had to wear more dresses in order to get the letter?
She's a cis woman who was in the counseling session wearing pants and a blouse. And she told me if I didn't stop wearing pants and start presenting more feminine in dresses, that she wouldn't write the letter saying I'm a trans woman, that I should be able to access estrogen and hormones.
How did that feel in that scenario?
I was extremely frustrated, and I walked out of there. I'm like, what the hell? Like, you're telling me that I have to wear dresses and like present in a way that you think is, you know, a stereotypical woman for me to even access hormones. And that was kind of the starting of it all for me, that realization of like, oh, okay, I have to perform femininity a certain way, otherwise I'm not going to be able to access healthcare. You just kind of go in and you tell them what they want to hear. So I'm like, I walked in, I'm like, oh, you know, I'm attracted to men, and like, I've had dysphoria since I was a kid, I hate my genitals, all that sort of stuff, because I didn't want to risk being denied hormones. Right from the start, it gets into this, oh, well, okay, well, how much do you hate yourself? Let's go through this checklist. Do you hate this about your body? Do you hate this about your body? Like, we're not allowed to feel good about ourselves. But it's also been frustrating going through all this, is like that they only offer genital surgery for trans women.
In Ontario?
Yep.
Only genital surgery?
Only genital surgery for trans women. So they won't cover like breast construction or anything like that, or facial feminization surgery or facial hair removal. And those are things that I'm much more dysphoric about than my genitals. So it's kind of feel like, again, I'm kind of forced to be like, go along with this. Okay, this is what you tell me I need to be bothered by as a trans woman.
Today I'm having a consultation for my top surgery. Because New Brunswick doesn't cover top surgery, I'll have to pay for this out of pocket, something I can't afford. So like many other trans people in New Brunswick, I've been crowdfunding to reach my goal. This is the part of every application that really kind of sucks for me. This is where you have to decide if you're male or female. I never really know what to do here. I wish there were other options.
Yeah, well, I know he's pretty well known in the trans community, which is great. So thank all your friends for the referral. Actually, top surgery is our #1 surgery, so I'm not surprised you've heard about us. We do sometimes as many as 5 or 6 in a week, so it's quite popular here.
Hi.
Nice
AJ?
to meet you. Yeah.
Hi, I'm Dr. McLean. Nice to meet you.
Yeah.
And so, personally for you, where are you as far as gender goes?
Right, so I would say I'm non-binary and I'm trans-masculine, so I identify with the pronoun they, them, theirs, but I also am okay with being read as he. I'm very comfortable on the masculine side of things.
So when you think of your breasts and you think of the feelings you have about them, what kind of emotions are there?
When I look in the mirror, I just feel like maybe they don't belong and that they cause undue stress because of the shirts I want to wear or the clothes I want to put on. So they make day-to-day difficult because I am quite large-chested, so it's hard to bind.
Okay, so we'll take a look at you.
Yeah, sure. So this is the most awkward. My paper towel again.
Okay. Got some good muscles.
Yeah.
So, do you mind looking in the mirror for me? And then we join them together.
Yeah.
And then we have to downsize this and move it. So we can go up under here to get the breast tissue out and then join those together. And that gives you the scar that you get, and that's forever. So you have to be willing to have that scar forever.
Yeah.
So we here charge $7,500 plus your taxes. So it's a total of $8,475.
And how far booked is he?
Well, it's been a very busy year. We generally book about 4 to 6 weeks from the day of consultation. And this is why I say it's been a strange year. We are booking it to December right now. So it's past that 4 to 6 weeks timeline.
That experience was pretty bittersweet to me. I'm feeling really excited and happy that I know I can get the surgery if I can raise the money. I mean, the bitter part is knowing that so many people have to go through private access to these surgeries, that they aren't publicly funded, and that all of these people, all of these trans people are paying out of pocket and might not have a support system in place to help them with recovery. And I just feel like it's great that these surgeries are happening. It's great. They seem like lovely people. I just wish that the access was there for everybody. If they're doing 100 a year, that means there's probably, thousands that aren't able to afford it.
So I'm Alison Charlebois, and I'm a family doc here at the Village Family Health Team, which is in Toronto.
What's your patient load like?
I have somewhere between 800 and 900 patients.
Oh, wow. And of that, how many patients are trans patients?
Somewhere around 50 to 60.
And so you said you are a GP. Is it a common practice for GPs to prescribe hormones? Is it possible to do that without the intervention of an endocrinologist?
Absolutely. I think it's well within the scope of a family doctor, and the only way we'll be able to have reasonable access for trans folk is if GPs are doing it.
And so what might be the barrier? Why aren't more family physicians doing what you're doing across the country or even here in the province?
I think it's a number of factors. There's very little training, if any, in most medical schools. There are some efforts at some schools to start working on that, but for most doctors who are out there, they would not have been exposed at all to prescribing these kinds of drugs for these purposes in school. And then transphobia, I think, is the other major reason that this isn't happening. It's, people have a lack of knowledge in the area, but also some prejudice that makes them feel that this isn't something that they should be doing.
At least the way I experience it, kind of an adversarial process where I feel less like a social worker and more like a lawyer working with a client to sort of make their case.
And when you say make the case, who are we making the case to in this scenario?
We're making the case to places like CAMH where people have to go through a number of steps. People have to have 1 year of a lived experience, so basically completely expressing their gender identity in roles like work, school, family life. I think this is the most difficult part for people because I think it puts people in uncomfortable spaces where they have to choose, am I going to be able to obtain the surgery that's essential to who I am, or am I going to be able to keep this job that I need in order to pay for other surgeries that may be just as important for their transition, but for reasons that I can't fathom aren't covered by the Canadian government.
How old is your daughter?
She's 9.
When did she come out as trans?
It was April of 2015, so it's very new. And it was very natural for her. And we had so many comments about how composed she was, how in control. And for her, it was just seemed like a logical thing to do. I don't think she really understood what it all meant.
No, but it's obviously time.
And fairly supportive, her class community?
Yeah. So the whole class was very supportive, and they're almost a little bit protective, I think, which was very sweet.
So we went to her pediatrician,
Okay, great.
and no, I don't think that there was a lot of knowledge.
Yeah,
I mean,
you were at that appointment.
yeah, I just don't think there was a lot of knowledge. Not that there was any issues, just that just you could see that they were a little overwhelmed and probably were happy to refer
Yeah.
on. So I was really nervous about that appointment
Okay.
because I didn't know the reaction, and having her in the room, and she's very intuitive. She picks up on everything.
Right.
Just realizing, like reinforcing that, you know, oh, this is different. I'm different. And she feels that she's just herself.
Right.
Because we know that one of the biggest priorities right now is figuring out whether she needs to go on hormone blockers, you know, to delay puberty, because we know that's one of her biggest anxieties and is about, you know, having to, you know, morphing into a male's body when that may not be what she wants to do. So she definitely wants to have more time. I mean, she's already thought through everything. She's already thinking about what, you know, family and kids. I mean, she's really mature. So we have to be ready for her questions too.
Right.
So yeah, I think it's only going to get more complicated. I know it's going to get more complicated.
So we're heading out to a queer campground. That's pretty exciting for me. I've never been to one. We're off to visit Rachel, who's in recovery from a recent gender-confirming surgery. I'm really looking forward to chatting with Rachel about her experience navigating the healthcare system. Hey.
Hey, AJ, how are you?
Good, how are you?
So
Rachel?
nice to meet you. Same here. So nice to meet you as well.
This is so cool.
Yeah, it's really just a nice place to be, you know, when you're recovering and, you know, you just need to be somewhere else. This is the dance hall here.
Oh, nice. Big turnout?
Oh, every night, yeah, 200, 300 people, yeah. Or every Saturday night, yeah.
Amazing.
Yeah, we have a saying here at the park that once you come into this park, the whole world disappears. You know, like there's no transphobia here. There's no queer phobia here. You know, everybody here is so loving and accepting. It's just like it's your family, you know, here. I had a 25-year IT career, and I helped to start a lot of the technology that's used today. And so suddenly, you know, I had built this wonderfully great career that was just gone like a puff of smoke. It was gone. This is not just my story, it's everyone's story, and that's what they go through, you know. But for me, it was a real possibility that I was going to be, you know, on the street. So I did what 41% of trans people do, and I tried to kill myself because there just was no more hope for me.
Maybe we'll talk about when you got the doctor that was able to help you, and that's when you probably started navigating through the healthcare system a little bit more freely.
Yeah, I mean, I think the first piece of advice I got that was positive is put your name on the gender reassignment surgery list because it's so long, it will take forever to get through it. So that was the very first thing that I did is I got the referral to CAMH to put myself on that list. In terms of CAMH, they've been labeled the gatekeeper by the Ontario government to do this. And it's not their fault they're overwhelmed with the work, you know. It's not their fault that trans people are feeling safer to come out. And I don't think that one organization should ever be the gatekeeper of trans surgery. For me, the process took about 2.5 years, but I started a long time ago. As we advance forward, more and more trans people are feeling safer to come out. That period of time extends, it expands every day. Oftentimes what I see and hear from especially the conservative government is, well, why should we fund this? It's so expensive. You know, before I got surgery, I was a very unhappy person who was in and out of psychiatric hospitals and costing the government tens of thousands of dollars per year. And in order to fix that one time, they paid $20,000 for me to have gender reassignment surgery, and I've never visited any of that at all. When you do that math, what we end up finding is that healthcare costs go down for the government as a whole. You know, so gender reassignment surgery is actually saving people money. So the federal government says to trans people that you are not valid enough for us to give you proper health care.
You know, we don't want to fund gender reassignment surgery. However, without having surgery, you can't change your documentation. You can't apply for things like OSAP, which is education. You can't go down and get your social insurance card changed. It starts this enormous spirality of this horrible, you know, downward spiral that you go through where you just get to the point where there's no other thing. And I said earlier that it's not CAMH's fault, it's not your doctor's fault, but it is the fault of the government. It's 100% without question the government's fault. And based on so-called conservative values and applying them to something they can't possibly understand, that has to change.
So it's Wednesday, and this is the time when I do my injection. I've already washed my hands. As soon as it's done, it's just like this calm. I just feel relaxed, I guess, more than anything, and confident that the medication's gonna continue to make me feel more comfortable in my skin every week. If you're not one of the 43%, then you have a lot to celebrate. You've made it, and your story is a story that younger trans people, hopefully, who are just coming out can hold on to and hold up when things get difficult, because they probably will still for a while. As terrifying as losing family or partners or jobs or any of that is, I think what's more terrifying is knowing that for the rest of your life you'll always feel like something was missing, and that's how I felt. If we can just alleviate that one barrier in our country, if we can say, we see that you're doing this thing where you're trying to love yourself and be yourself, and we support that at a governmental level, we support that through healthcare, we will provide you with the resources to do that. We know that that's saving lives, and that everything else can be worked on, but if you can't get access to the simple medication you need, then you're constantly delaying that level of compassion. I think if you're choosing to medically transition and you don't have access, then your life is on hold.